Hey 301ers, we're the Jumpstreets, and today we're going to talk about how exercise training improves functional recovery and motor nerve conduction velocity after nerve injury. According to WebMD, 100 million people in the US live with chronic pain, and part of those statistics are nerve injuries and nerve damage. Nerve injuries can cause loss of the ability to use your limbs. It can cause tingling and numbness, and just overall severe pain. And the reason why the scientists wanted to look into this and do this study is because a lot of the time when people have these types of injuries, they go to the doctor and they're treated for their symptoms rather than actually rehabilitating from the injury itself. And so this can be applied to people with paralysis, quadriplegics, severe nerve damage, and spinal cord injuries.
A European study attempted to research this axon regeneration and whether or not exercise was dependent in accelerating the nerve regeneration. They used rats in the study and had 4 groups of rats each perform exercise that included light, moderate walking for an hour on a treadmill, and then they had another group of rats perform more intense training that included 2 minutes of intense running and 5 minutes of walking, which was repeated several sets. Each of the exercise groups began their 2-week exercise program 3 days after the nerve damage. There was also a control group in the study that consisted of non-exercise rats, and after the study, the results were examined to compare the non-exercise rats against the exercise rats, as well as male versus female rats.
After collecting extensive data, the results showed that exercise training causes an increase in functional recovery during the beginning phase of the recovery period. Another important finding showed that during the later stage of the recovery period, motor nerve conduction velocity was noticeably better in the trained group compared to the control group. This means that the rats in the trained group were able to function more efficiently while recovering from peripheral nerve lesion due to an enhanced ability of motor nerve speed. Furthermore, the study proves that the return of sensory and motor capability while recovering from peripheral nerve lesion is significantly improved as a result of exercise training.
So what exactly can we conclude from this information? Well, whether or not you decide to go into physical therapy, medicine, or any other type of rehabilitational program, we can come to the conclusion that exercise is never a bad thing. For the rats, exercise proved to be vital after a nerve crush injury, and without it, their progress in regaining nerve control and function would be a slow and tiring process. We can use this information found in the study and apply it to ourselves by using this knowledge to inform others about the positive outcomes that can come from exercise. Instead of using pharmaceuticals to promote nerve growth and regeneration after a life-devastating accident, we can use exercise with positive reinforcement to actually have these patients with extensive nerve injuries, or even have paraplegic or quadriplegic patients foresee a positive outcome in what seemed to be the end of the road for them. We can also use this study as a base to further investigate the effects of different types of exercise on sensory and motor regeneration, as well as how stress plays a factor in the overall outcome.